welcome to what I promise will be fun, insightful, and maybe even eye-opening forum titled Veterinary Clinics and Pet Healthcare Industry. So now, before you start imagining your cats doing yoga or dogs calling their vet over Zoom, let me tell you something. You're not far off, okay? We're living in a time where veterinary clinics are no longer just places to get shot. We're talking about digital consultation, holistic healing, and boutique-style pet clinics. So, and today we have three amazing panelists who are going to break it all down for us. So let's meet them. First up, we have Nisa, who will talk about how telemedicine is changing the way pet owners connect with vets anytime, anywhere. And the next panelist too, this person unfortunately cannot come physically because for some reason, but she still make it up to be with us through the online version. And here we have Shufina Aisha, who's diving into alternative pet therapy, stain acupuncture, herbal care, and natural healing for pets. And yes, it's real, guys. And the final panelists, we have Nurshazrin Shafiqah Hani, who's bringing the big picture how the pet healthcare industry is booming, transforming, and adapting to modern trends. So, are you ready to hear about this interesting topic today? So let's kick things off with something that feels very 2025, digital pet care. So we got Nisa here to talk about telemedicine in veterinary practice, a game changer for busy pet owners and even busier clinics. From virtual consultation to remote monitoring, this trend is growing fast. So Nisa, tell us a bit about how telemedicine is changing the way vets and pet owner connects.
Alright, thank you Zati, I'm moderator, and thank you for the honor for having me here today. Okay, telemedicine is really transforming the way vet and owner connect by making veterinary care more accessible, more flexible, and also convenient. Instead of having to travel to the clinic for every concern, pet owner can now reach out to their vet just through the video calls, WhatsApp chats, and also some apps, right, just from their home. So it is very special and helpful, especially in routine check-ins, follow-up care, minor issues, and also some behavior consultation, where a physical exam might not be immediately necessary. But it also reduces stress for the pet who dislike the car rides and also waiting rooms. Okay, just like my pets. Alright. For vets, it means they can maintain communication and support even after hours of the client from the remote areas. It also helps to strengthen the vet-client relationship and ensure the pet get attention faster. While it's not a replacement for the hands-on time, but the telemedicine is becoming a valuable tool that can enhance care and also not replace it.
Nisa, telemedicine sounds super convenient. It's like I can call the vet while my cats sit on the laptop. But here's what I'm curious about. How do vets make sure that remote consultations still give accurate results? And how do they build trust when they're not physically with the pet? Are there any challenges for veterinarian faces?
Okay, first of all, yes, you're right. The telemedicine is incredibly convenient, of course. Okay, it allows pet owners to reach out to their vet from the comfort from their home, whether it is a quick follow-up, a behavior concern, or advice of nutrition. But when it comes to the accuracy, veterinarians are very aware of the limitation. To maintain the quality care, most vets use telemedicine for non-emergency cases or ongoing condition where they already have some pet medical history. This way they are not starting from scratch. For example, if a cat has a recurring skin condition, a video call might be enough just for the check for the progress and also adjust treatment and also advice for the cat. They say for a new patient or a serious symptom, vet usually recommend an in-person visit. Remote tools just can't replace the physical exam like blood test, X-ray exam, and also telemedicine is more like a supplement, not a replacement for the traditional care. So as for the trust, of course, trust built with some time in the process. Just like a physical clinic, vet working remotely often spend extra time, as meaning that they are seeing guiding owners to perform simple checks and even using screen sharing or diagram. The key is clear communication and also transparency. Some platforms also allow recorded session, digital description, and also instant messaging, which help to build confidence and continuing of the care. Now about the challenges, yes, everything has challenge. Also for the telemedicine, telemedicine face challenge in form of they might have some poor internet connection, unclear video quality, and also uncooperative path that might make the exam more tricky. Alright, the pets might not stay in front of camera, it might run away everywhere, so the exam might be tricky. And then also there are some risks that some owners might delay their in-person treatment thinking teleconsultation is enough. That's why vet must be very clear of the limit what they can and cannot do in form of online. So in short, telemedicine is a valuable tool in modern veterinary care, but it works best when paired with a good clinical judgment and also ongoing clinical education.
Okay, I think I see a lot of focus spaces out there. So blink twice as if your pet is actually the reason you are here today. Okay, just joking. And thank you, Nisa. That was a very really insightful look into how technology is changing the game for veterinary service. So now let's switch gear a little from virtual vet visit to something a bit more holistic. Okay, alright. So next, Shukrina Aisha, who's going to introduce us to the world of alternative therapy in pet healthcare. So, Shukrina Aisha, are you there with us today?
Yes, I'm here.
Okay, we're talking about acupuncture physiotherapy herbs. Things we usually hear from humans, but yes, they use for pets too. It might sound unusual at first, but it's actually becoming more popular among pet owners who want something beyond just pill and injection. So, Shukrina, give us a quick insight into how these therapies are helping our furry friends.
Hi everyone. So sorry I couldn't be there in person today, but I'm really glad that I can still join you virtually and talk about something a little different but really fascinating. Alternative therapies in pet healthcare. Now, when we say alternative, we're talking about treatments like acupuncture, physiotherapy, herbal remedies, massage, even things like aromatherapy. They may sound like what humans use at wellness spas, but yes, they are very real for animals too, and they are gaining popularity fast. Why? Because many pet owners today are looking for more holistic options, not just treating symptoms with medicines, but helping the body heal and recover naturally. For example, acupuncture has been shown to relieve pain in dogs with arthritis. Physiotherapy helps pets recover from injuries or surgeries, and certain herbal supplements can boost immunity or reduce anxiety in stressed out cats and dogs. Of course, these therapies aren't meant to fully replace traditional vet care. They are used alongside it as part of an integrated treatment plan, and they're usually done by licensed vets or certified animal therapists. So it's not some random home remedy. At the end of the day, it's all about giving our pets more options to heal, feel better, and live longer in a way that are gentle, natural, and customized to their needs. So, yes, alternative pet therapies are real, effective, and becoming a bigger part of the future of animal care.
So Shakira, I love the idea of natural healing for pets, like a But some people might still be skeptical. So here's my question. How do you ensure the credibility and safety of alternative therapies, especially when combining them with modern veterinary medicines?
Thank you, Zati. And yes, a spa day for pets with medical benefits sounds like a dream, right? When it comes to alternative therapies, the key word is integration. These therapies shouldn't replace conventional treatment, they should complement it. That is why it is so important for pet owners to work closely with licensed veterinarians who are trained in these therapies, like veterinary acupuncturists or certified animal physiotherapists. Credibility comes from evidence based practice. For example, as I mentioned just now, studies have shown that acupuncture can help manage pain in arthritic dogs, and physiotherapy is commonly used in post surgery rehab. Also, safety checks are a must. Before starting any herbal or physical therapy, vets will do a full assessment to make sure it is suitable for the animal's condition. And just like with medications, dosage, timing, and monitoring are parts of the process. So it's not just about natural equals to safe. It's about professional guidance, proper certification, and balancing modern and alternative care to give pets the best possible outcome.
Wow, that was deep. I think even my cat is taking notes right now. Okay, from herbs and healing, now let's zoom out and look at the bigger picture of the pet health care industry. So our third panelist, Nurshal Shafiqah Hani, is here to talk about the growth of veterinary clinics and how this whole industry is evolving, where we see new clinics design, upgraded service, and a booming demand, but also high expectation from pet owners. So, Awi, tell us what's really changing in the pet clinic world these days.
Thank you for moderator Zati, and hello everyone. I'm glad to be here. Yes, the veterinary clinic industry is definitely going through a transformation. As we can see here, one of the biggest changes we see is a shift in mindset from the best say veterinary clinic to the more holistic pet care. As we can know, that clinic are for now not just places for sick pet, but also become offering grooming, offering wellness hub, physiotherapy, dental care, even nutrition counseling, and behavioral consultation. Another key evolution is in clinic design and technology. Many modern vet clinics now have look more like human healthcare facilities, such as more comfortable, pet-friendly, and equipped with advanced tools such as digital X-ray and in-house blood analyzer, cloud-based record system. This digital and technology helps improve diagnosis, shorter waiting time, and provide even better overall services. So overall, veterinary clinics are evolving to meet both medical and emotional needs, and it is exciting to see how this growth is shaping a more compassionate and comprehensive approach to animal healthcare.
The pet industry is clearly booming, and clinics are getting busier and pet care is more serious than ever. But here's my question. How do we make sure that as the industry grows, we don't lose the personal touch in pet care, especially when clinic starts to become more like business?
That's such an important question, Zati. Thank you for bringing it up. We know that as the industry become more commercialized, with clinic expanding and services become more premium, there is a risk of losing the emotional connection. The very thing that makes veterinary care so meaningful. So to keep the personal touch alive, I believe it starts with the clinic culture itself. No matter how modern or fancy a clinic gets, what truly matters is the heart of the people working there, like vet and staff need to be trained not only for the technical but also for the compassion, empathy, and also communication. It's about listening to the pet owner, remembering their pet's needs, being gentle with the animal, and showing genuine care. Secondly, we need to balance technology with empathy. For example, using digital system is, we know that it's very great for efficiency, but it should not replace face-to-face interaction. A warm smile, a reassuring tone, or simply taking time to explain things to worry pets parents make a huge difference too. So at the end of the day, pets also are family, and just like human healthcare, we must emotional side of the experience, because what comfort the owner ultimately comfort the animals too.
Speaking of try, my cat just launched her own F&E hub service. It's called Your Distance. So only open at 3 a.m. so you can bring your cats and come to my tiny cats. Okay, alright. So as an amazing first round, we explored some powerful insight from going digital to going natural to going big with industry goals. So how about we rest for a few minutes before we start the second round? Okay, so let's. Okay, we're back from our recess, and now we got some more energy to bring more information that for this forum today. So now we head into round 2, where I ask one big question that all the 3 panelists here will respond to. So here's the question. Here's the question. As pet ownership rise and people demand better care, what do you think is the most important step we need to take to make veterinary service more accessible and affordable, especially in rural or underserved areas? So we can start with panelist 1, Nisa, and then we go through the.
Alright, thank you, Zati, for that very interesting question. Okay, for the question, I will relate it with my study, telemedicine. Alright, as a pet ownership is continuing to rise, and especially after the pandemic, people everywhere from a big city to a small village want a better healthcare for their animals. But in some rural or underserved areas, access to the veterinary clinics are often limited. There may be only 1 or 2 vet clinics, but in some cases there are only 1 clinic in a huge region, or might not have any at all. So this is where the telemedicine can play a game-changing role. By using a telemedicine, veterinarian can provide the initial consultation, follow-up, advice, and it can save in some both time and also travel costs for the pet and owners. For example, instead of driving for 2 hours just to ask about the skin infection or vaccination schedules, the pet owner can do a video call instead, or chatting with the licensed vets that show the issue and get some guidance instantly. And not only does it reduce the transportation cost and waiting time, but it also allows the triage cases, helping decide whether an in-person visit is really needed or necessary, or the issue might be managed through online. Alright, to make this work on a wider scale, there are some steps that can be followed. I highlighted there are some 3 main key steps, which is the first one is we can expanding the internet infrastructure in the rural areas. Second step is we can provide the training and also tools for the local animal health workers to assist with the basic tech use. And the third step is we support the regulatory framework that allow the teleconsultation while ensuring safety and quality care. While the right system in place, telemedicine can make a veterinary service more affordable, more available, and also more efficient, no matter where the pet lives.
Thanks, Nisa. So telemedicine really is like giving your pet a passport to healthcare without giving the code. Though I still waiting for my cats to stop molesting herself on Zoom. Okay. How about Shafina Aisha in the online?
Thanks, Zati. Love the medicine joke, by the way. For me, one important step is to make alternative therapies more community-based. In rural areas, access to full veterinary clinics can be limited, but simple interventions like animal physiotherapy, massage therapy, or herbal supplements could be taught to a local caretakers, or even trained paraprofessionals under veterinary supervision. This reduces travel costs and it empowers communities to manage chronic conditions like joint pain or stress related behavior issues without relying only on the high cost medication. We also need more public education on what's safe and what's not. Not every natural remedy is harmless, but when done properly and guided by professionals, alternative therapies can be a low cost, accessible addition to basic veterinary care in rural settings.
Love that shoe. Affordable natural therapy for pets. And maybe humans. Just kidding. Unless you get a herbal stress relief for all our moderators. Okay, Shazin Shamika, how about you?
Thank you, Zati. I think that's a very crucial question, especially as the industry continues to grow and evolve. From what we discussed earlier, with clinic becoming more advanced, service expanding, and pet care becoming more premium, there is no doubt we're moving in a positive direction. But we also need to make sure that this progress don't leave people behind, especially pet owners in rural or underserved areas. In my view, the most important step is to bridge the urban-rural gaps in veterinary access, and one way to do that is by leveraging mobile veterinary services and telemedicine. These are two growing trends in the industry that can be a real game changer. Mobile vet clinic can bring basic services like vaccination, deworming, or also health checks. And directly to remote community at the same time, teleconsultation can offer pet owner advice without needing to travel far or pay high consultation fee. Secondly, we need to invest in local talents, like supporting more students from rural backgrounds to study veterinary medicine and back return to serve for the community. Could also make a big difference. It's not just about the clinic; it's also about the people behind the care. So yes, as we move toward more high technology, modern pet care, let's make sure accessibility and empathy grow alongside it.
Beautifully said, Arwin. Like the person, a growing industry doesn't mean leaving anyone behind, especially not our combo cats and village pups. Alright, so that's wrap up our forum on veterinary clinics and pet healthcare industry. We've gone from virtual vet visit to natural healing and a glimpse into the booming pet care business. So to our awesome panelists, thank you for sharing your knowledge and passion. And to everyone tuning in, whether you are a future vet, a current pet parent, or just someone who's secretly watching this with your cat on your lap, we hope you live with something new today. Remember, happy pets make happy people. And sometimes all you need is a vet, a little love, and maybe a few treats. Thank you all. Stay safe, stay kind, and don't forget to give your furry friends an extra hug today. And that's all for us. See you next time. Bye!